viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Hello, friends, and welcome back to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and I have another interesting topic for you today: the connection between oral health and chronic illness. Your mouth is more than just the gateway to your body. It's a mirror of your overall health. To explore this topic, I've invited Dr. Nammy Patel, an integrative biological dentist and author, to uncover how hidden dental toxins, from mercury fillings to root canals, can silently contribute to chronic illness. Together, we'll explore how restoring oral health can unlock whole body healing, boost vitality, and even reverse systemic inflammation. Dr. Nammy Patel is a trailblazing biological and holistic dentist, best-selling author, and global health advocate who's redefining dentistry for the 21st century. As founder of Green Dentistry in San Francisco, one of the nation's first eco-friendly holistic dental practices, she blends advanced technology and Ayurvedic and functional medicine to treat the whole person, not just the mouth. Featured in Forbes, ABC, NBC, and more, Dr. Patel uses cutting-edge diagnostics, oral microbiome testing, and AI tools to uncover early signs of disease and promote true prevention. Her mission is to transform dentistry from a reactive drill and fill model to a proactive, data-driven path to full body vitality and longevity. Welcome, Dr. Patel.
Thank you for having me, Scott. I'm excited to be here.
Yeah, I think this is going to be an interesting topic because I don't think a lot of people really realize the connection between your oral health and chronic illnesses. In fact, I was talking to a coworker as I was walking out the door that I was going to be recording this podcast, and her response was, I want to listen to this because this sounds like an interesting topic. So I guess the first thing we want to know, what inspired you to specialize in biological dentistry and connect oral health with systemic wellness?
Well, one of the reasons I started doing this, sometimes I call it fate. I grew up in India, and I was born in my little village of 8 houses. So there's trees in the front, trees in the back, trees on the side. So very organic background. I grew up in a religion that was based on Jainism. So we give everything a lot of value. So hence the eco-consciousness aspect of it, not being wasteful, thinking things through. Also learning yoga at a young age. I started yoga when I was 8 years old. So really understanding breath work and how important, the airway is to your overall health and longevity. And then fast forwarding to my college years, dental school was, tough. And so I had a lot of cortisol spikes, and they kept telling me that I was depressed when I'm like, I'm telling you, I'm not depressed. I just have a lot of anxiety. Turns out my body doesn't absorb vitamin D3 as well. So, of course, I was exhausted all the time.
Right.
Now, fast forward that a few more years, I got out of dental school, opened my practice, and my brother, who was 33 years old, passed away from a heart attack. And one would wonder, like, why, how, what occurred. And the ironic part is that he'd gone to a dentist just a month before, and nobody ever noticed anything. Nobody ever put anything together. And of course, I was wondering, what can I do better? There's got to be something that I could have done to be preventative. He went in for a root canal consult, of course. So just wondering, what was going on. And so I really wanted to make sure that I had an impact on my patients. And I definitely didn't want to do the whole drill and fill dentistry. If there's a cavity, of course you need a filling, right? But I wanted to go beyond that and really focus on prevention because and diagnostics have evolved. I've been practicing the last 20 years, 20,000 mouths. I've discovered a lot of things. In science has come such a long way, and especially
Hmm.
with functional dentistry. Just like in functional medicine, we can test what's going on. We can do that with dentistry. Instead of blood work, we're using saliva to be able to test the specific bacteria that cause heart attack, diabetes, cancer, Alzheimer, arthritis. We can even see people have acid reflux. We can see a number of things that are going on. And to be able to serve our patients so that they can live a long, healthy life is amazing. And then tying it back to the breath work, we now realize that people have had braces have shrunken sinus cavities. And so we can 3D expand sinus cavities to make more nitric oxide, which naturally helps you fight heart attack, diabetes, cancer, Alzheimer, arthritis. So that's really awesome. And, I feel like a purpose driven life is what I'd have to say.
Well, that's good to have a purpose and a passion that you can align your values with and do as part of your career. I'm a advocate for holistic wellness and considering the whole person. Even so, I think a lot of people don't really consider dentistry as part of a holistic practice. We kind of ignore the mouth unless there's a problem with the mouth. So when people consider general dentistry as separate from general wellness and health, why is that a dangerous misconception?
The main reason is your mouth is connected to the rest of the body.
Yeah.
It's not different. And I really don't even understand why there's medical insurance and dental insurance as
Hmm.
if they're two separate things. We're quantum beings. We are connected. And the first thing to start with is you swallow bacteria every single day. And that's just you swallowing with eating and things like that. And you're swallowing all that bacteria and it's going right to your gut. And we see so often gut gets addressed, but forget about the mouth. And it's like, well, of course, disease is going to come back. It's just a matter of 2 years, 5 years, or 7 years. And so when we actually address it at the root or the beginning stages, where the oral microbiome, where you swallow bacteria, making sure if the mouth is clean, the gut will be cleaner. And then also, once you treat disease, it'll stay away for a longer period of time because you don't have pathogens that your body has to fight, right? I mean, we
Hmm.
know everything's inflammation. What kills us is inflammation. Basically, aging is inflammation. So our goal is to reduce the amount of inflammation that occurs in all areas of our body.
I want to talk just a little bit about current dentistry and how do common dental materials like mercury amalgams and fluoride and BPA based composites affect the body long term?
Well, the thing with mercury is that mercury is a toxin, and the most amount of mercury that's problematic is when you're drinking a cup of coffee or grinding your teeth or chewing something. That's when the mercury is released. And the reason why we are concerned about mercury is because it's a neurotoxin.
Right.
It's related to Alzheimer's, of course. It can stop your brain from forming the cells that they need to, so memory problems. It can have problems with your kidneys, your liver, pretty much every single pathway. The thing with mercury is that it actually binds to our amino acids when we don't want it to. So our DNA works in a specific way and our bodies work in a specific way. There's different molecules that exist and they all work with each other because there's attraction.
Hmm.
Now, when mercury is present, mercury has a higher attraction to these molecules. And what it does is, like, for example, let's say we have our DNA and our DNA is supposed to make an apple. When mercury is present, because it binds to glutathione, what's going to happen is that instead of an apple, you're going to make an orange. And so if you make an orange, it's acidic. It's going to have different functions. It's going to impair the way in your entire body works. And so it causes a lot of chaos in the body is the right way I could say this. And it
Right.
causes a lot of problems and it decreases lifespan, increases disease. And I mean, there are so many patients who have problems with, are diagnosed as like bipolar or depression or anxiety. All of these things actually are just mercury toxicity. rather than, actual diseases.
Yeah.
So that's a huge, huge, huge concern. Now, when it comes to root canals, the problem with root canals are that if there is a foci of infection, that is a huge concern. Root canals are a dead tooth, so those dead teeth need to be cleaned out. And when they're not cleaned out properly, what happens is that there's a little foci of infection that sits around. You let that infection sit around for a few years, it manifests as cancer, it manifests as certain diseases. And that's the real concern with root canals, and especially failed root canals when they are done without lasers, they're done without microscopes, they're done without special technology. It really, really, really causes a lot of problems. Let me also phrase though, not every root canal is bad. There are certain root
Sure.
canals that are done with minerals, are done properly and with ozone, but there are a lot of root canals that are not done so well. So we want to be mindful of that for sure.
Yeah, that was some of the interesting research that I came across a few years ago was associating the root canals and those chronic infections and the systemic inflammatory response that they produce, triggering these chronic illnesses. And it was a little bit shocking to me, I would say, that that was the case. You kind of touched on it or hinted at some of the things, but if somebody goes to their dentist and they say, "Hey, you need a root canal," what alternatives are available for that person to treat that infected or inflamed and dead pulped inside a tooth?
The first thing I would say is, not every tooth needs to be extracted. And
Mhm.
I really want to be honest about that because I've witnessed a lot of dentists take advantage of patients and say, you need this tooth pulled out and an implant placed because you might get some diseases and stuff like that. So I don't want the scare tactic. That needs to be addressed, number one. For me personally, what I like to do is I like to test the person. So what I usually do is test the genetic risk of chronic illnesses. 20% of the population has this problem. Not everyone is prone to the same amount of diseases, right? All of our genetics are very different. My sister and I are a perfect example. She's high interleukin 6. She's more prone to diseases. I still haven't gone COVID and I worked during the whole time because my immune system is just stronger. So when I find patients who have a high inflammatory response and are more prone to diseases, those are the patients I may say, hey, you know what? If you're going to get a root canal, it needs to be done very safely. And the way that it's done is through certain processes. So, with multiple layers of disinfection. And I would monitor them on a regular basis. Like every year, we would do a salivary test to make sure that there's no foci of infection beginning. If there was somebody who has history of cancer or something like that, or has the gene for cancer, I'd be like, hey, let's take that. Let's not even go down the root canal path. Let's just go down the implant path, but let's customize it for each person so
Mhm.
that we're not over treating and we're not under treating. We're treating patients exactly where they need to be. And also, we are making an effort to save the tooth. The reason we want to do that is because I talked about, laser therapy for root canals and things like that. The reason why we want to try to save the tooth is because in the root of the teeth, there are stem cells or the periodontal ligament, and we want to preserve that because that's what keeps the bone around. And it really keeps the osteoblasts and the osteoclasts active. And we want those things because they're part of normal bone formation, normal healing. And then also, we want teeth so you can chew, so you can get your
Yeah,
nutrients. If you
kind
don't
of
have teeth,
important.
yeah, it's kind of hard to be able to chew if you don't have that.
One of the other things that I've seen in the research is a connection between dental infections and metabolic disorders and also autoimmune conditions. Can you speak to those a little bit more? What's the process or the mechanism by which dental infection is triggering these?
Absolutely. So with autoimmune infections, actually, there's going to be twofold. One is going to be a majority of the patients who have autoimmune conditions are interleukin 6 high genetically, right? We see that their system is more active. Stressors. We see a lot of stressors that are either death, disease, divorce, right? 2 years, your body's usually able to compensate, but after that, the cortisol levels do impact the autoimmunity. And the most important thing that I see from a dental perspective is one is the microbiome. There's a lot of bad bacteria that's in there because their system is overloaded. And second, their functional airway is problematic. If your body is not able to rest well with good sleeping,
Hmm.
and why sleep is really important as a dentist is because If you touch your nose, right underneath there is your mouth. Your upper dental arch is where your tongue sits, and it actually helps activate the vasovagal response. So your body rests. And when that tongue is at the roof of the palate when you're sleeping, it actually helps you have more REM sleep. REM
Mm.
sleep is when our body regenerates. It's when we get rid of toxins. It's when our body is taking out cancer cells. Your body is at rest and digest. What we find with a lot of patients who have chronic illness and disease is that if this is their palate, their tongues, which should be like this, are like this. So they don't have that suction. If that happens, what happens is that what we'll notice is the snoring,
Mm-hmm.
right?
Yep.
And when that's occurring, we're not getting the nitric oxide that we naturally get through breathing through the nose. Number one. Number two, our bodies are not getting the REM sleep because it's never able to fully relax. What we want the REM sleep is our entire body is paralyzed and our body is strictly just focusing on essential functions, regenerating, getting rid of toxins, and also keeping us nice and young. That's what its main focus is. And when that tongue is not in the right position, it actually keeps the body with higher cortisol levels, and those higher cortisol levels are when we actually see patients with a lot of autoimmune conditions. Typically, we see them in threes. So we see hypothyroidism. We usually see eczema is a second one. And the third one that we see is like Crohn's disease, a lot of gut issues. And
Mm-hmm.
again, the reason for these things is that sinus cavity is super important to be able to get nitric oxide. And people who are sleeping with their mouth open aren't getting that nitric oxide. And we know that nitric oxide is really important in our gut, right? It actually gets
Mm-hmm.
absorbed in our duodenum, which is the beginning of our intestines there. So we find that most autoimmune conditions come in threes for patients. And we also see actually a lot of arthritis. That's the other thing that we see is definitely a lot of arthritis in patients.
When someone's considering their overall health and their oral health, what are some early warning signs they should watch for in the mouth that may indicate that they have deeper health issues elsewhere in the body?
The first thing I would say with the patient is always, do you bleed when you're brushing or when you're
Mm.
flossing? So if you notice any sort of bleeding, you've got the beginning of a systemic, well, the bacteria from the mouth have already invaded the bloodstream.
Mm.
So that's number one. The second thing I always say is that put your hand in front of your mouth and exhale and breathe and see if that's smelly or not. If it has a foul odor, those are sulfur causing bacteria. So you either could have acid reflux, you could have a dry mouth, you could have a lot of different things going on. And that is a really good indication that the breath really lets us know how things are functioning. If you have a dry mouth, which happens to a lot of, perimenopausal women, menopausal women, or sleep apnea patients, or people who are on antidepressants, when you have that dry mouth, what that dry mouth starts doing is making those bad bacteria overgrow. That's the reason we start with that simple test, or that just, breathing into the mouth, that smell, if it's, funky, for lack of a better word,
Mm-hmm.
we know that there's something that's wrong and we want to take a look because it really means that the environment is present. For example, mold only grows in dark, humid environments. So these bad bacteria that we're looking at, the five red light bacteria is the ones we call them, they're actually growing in dry environments
Mm.
because the mouth should technically be moist.
Yep.
We want saliva in the mouth all the time, but certain times, certain conditions make the mouth really dry and it make these bacteria over.
You've mentioned the bacteria, and so that gets right into my next question, which is in relation to the oral microbiome. A lot of people are familiar with their gut microbiome. There's been a lot of awareness brought to that in the recent research, and lots of people are talking about it. But fewer people are actually talking about the microbiomes we have all over our body, including in the oral cavity. And so, how does the oral microbiome influence both gut health and immune function?
Absolutely. This is a great question. I'm so glad you brought this up, Scott, because people have been talking about the leaky gut forever, and then there is the leaky brain, right?
Right.
Alzheimer's, right?
Mm-hmm.
But people always forget that it starts with the leaky mouth. at the source. So the reason why we're concerned about these bacteria is because when we talk about the oral microbiome, everything we have good bacteria and bad bacteria everywhere, right? Even in our skin and our gut, everywhere. What happens is certain times, certain conditions, right? A dry environment makes these bacteria overgrow, and especially the ones that cause disease. Now, these bacteria probably weren't around 100, 200 years ago, is because people died when they were 40 or 50, right? People weren't living beyond 60s. And as people are living longer, what's happening is that the tongue position is changing. And that we have people, well, just like we get wrinkles on our face, the tongue starts getting wrinkles.
Mm.
So as the tongue starts getting wrinkles, pretty much everyone starts snoring by 50s and 60s, and they get diagnosed with sleep apnea. That dry environment is what's creating a specific brewing ground for these bacteria to overgrow. And there's these specific bacteria that go through P. gingivalis, cuts through the blood-brain barrier because it's so
Hmm.
small. When it goes into the brain, your immune system tries to fight it off, and as it does that, it leaves some damaged tissues, and that's what we call Alzheimer's, right?
Mm.
When they go into the stomach and break the enteric lining, we've got SIBO happening. When they go into the bloodstream, it starts binding to cholesterol. When they break through the enteric lining, they have access to the bloodstream. When they go into the bloodstream, your body, again, it's inflammation. Your body realizes these bacteria should not be there
Right.
because your blood should be sterile, right? And so your body tries to fight them off. As it starts fighting them off, it binds to cholesterol. So as it binds to cholesterol, it starts occluding the arteries, and that's how they're related to heart attacks and strokes. There's certain specific bacteria that actually attack the pancreatic cells. And when they attack the pancreatic cells, they actually cause cancer, and that's one thing. The second is that when your body has so many bacteria in the body, it's a bidirectional relationship. Our bodies need more energy to be able to fight those bacteria off, so it's going to need to produce more insulin. So one side, it's attacking the pancreas. Second side, it needs more insulin. So what's happening is that has a massive impact on the metabolic pathway. And also, certain bacteria are also related to cancer, just like
Hmm.
PV is related to certain types of cancer, it increases the predisposition of. Presence of these red light bacteria increase the risk of cysts, increase the risk of tumors. So we really want to be mindful of that. And then, of course, pregnant women, there are certain bacteria that pass through the placenta. And when they pass through the placenta, can cause ectopic pregnancy. It can cause damage to the fetus and has a lot of other concerns besides the microbiome. But the pathophysiology of bacteria is inflammatory. And when we look at these bacteria should only be present in certain places. If they're in the
Right.
wrong place, it's what we call disease. If we find it in our brains, that's a problem. If we're finding it in our blood, it's a problem. When we see it in the fetus, that's a problem as well.
When these bacteria get outside where they're supposed to be, they trigger an immune response. And that immune response usually leads to inflammation. And if it's not addressed, the immune system doesn't handle it properly, then we start to have a systemic inflammatory response that is chronic or persistent. And even a low-grade persistent inflammatory response can trigger a variety of different conditions and diseases, which makes it super important for us to address these bacteria and these dental infections. For someone that's maybe dealing with chronic fatigue, pain, or brain fog, how might addressing dental toxicity make a difference for them?
So many different ways. If somebody's dealing with chronic illness, we're first going to go to the oral microbiome. We're going to go to failed root canals. We're going to look at silver mercury fillings. We're also going to be looking at their sleep. Beyond that, the other things we'll be looking, which physicians do really wonderfully, is also to look at vitamin D3, really making sure that all the vitamins and minerals are in place that are needed, and especially zinc is very important. So really making sure the trace minerals, vitamins are in good standing to be able to help support the bodily functions. Classic B vitamins get ignored so much, which I feel like in functional medicine we really look at. And those Bs are really important to make sure that all the pathways are working properly and really helping with lowering our inflammation. The things that I see most, getting rid of the bacteria in the mouth definitely makes a huge difference. Sometimes when there's a chronic foci of infection, like a failed root canal, that makes a massive difference. And especially like I have a lot of patients with like fibromyalgia. We've cleaned their mouth up, and some of them are on walkers where they can't walk. To come into my office and walk the entire hall is pretty fantastic. So it's
Mm-hmm.
really amazing to see how quickly these results happen. I had somebody today who has chronic illness. And we just did the first, I didn't even have the microbiome test ready yet. So I said, let's just do a basic cleaning on you with ozone, and then we'll see your results and then modify things as we go. She comes in, literally, I saw her last week, and then she comes in and she's like, I'm ready to do the deep cleaning right now because let me tell you, my joints don't hurt.
Yeah.
That's gone, and I've been suffering with joint pain for years. And so she was delighted. And I was like, hey, I don't have all your reports. She's like, I don't care. Let's go. Let's do this because it's already making a big difference on me by the little that you did. I can only imagine what I would feel like once we're really customizing my care and removing these bacteria.
That makes total sense that we've just got to focus on proper microbiome health throughout the body, and that includes the oral cavity. What when somebody obviously we don't want to just disregard taking care of our teeth, and a lot of people look at, well, all I have is fluoride alternatives for my toothpaste, and they don't want to use fluoride, and so it makes it challenging for them to know what to do because a lot of the dentists are going to tell them to use that fluoride toothpaste, and so they get conflicting information. What, as a biologic dentist, what safer holistic alternatives do biological dentists use for fillings, whitening, and even just overall oral care?
Yeah, absolutely. Those are great questions. So the first thing I always say, fluoride is outdated. We now have hydroxynanoappetite, which is
Yep.
wonderful. I always love that the hydroxynanoappetite, especially on an electric toothbrush. It really does a wonder to keep the mouth super clean. And it keeps the homeostasis in the mouth too, which is what I really like as well.
Mm-hmm.
So that's number one as far as a product that I really like. The other one that I want to talk more about is, Listerine and all these mouthwashes they're a bunch of caca. Let's just let them go. They have alcohol in it. They're going to dry your mouth out. The one that I prefer is if you do have dry mouth is going to be Stella, Stella, a
Mm-hmm.
mouthwash. It's wonderful. It has coconut oil rinse in it, so that works wonderfully. And more importantly, the other one that I really like is actually Berkeley Life has a nitric oxide prebiotic gum, which is wonderful as well, especially in between meals. If you don't get a chance to brush your teeth, you can use that, and it works really great. And those are my things that I really, really like. I actually have to go back though and say the fundamentals are really important. Flossing, super important.
Mm-hmm.
Brushing your teeth with electric toothbrush, scraping your tongue,
Mm.
that is super important. Your body detoxes through your tongue. So scrape your tongue every time you brush your teeth. And you can do it with a toothbrush. My personal favorite is an actual Indian tongue scraper because it exfoliates at the same time and you will see stuff come out of your tongue that you would have never believed is there.
Mm.
It's almost like a dead layer of skin that's coming off. So I'm a big fan of that. And then the other things that I always, always recommend for patients to do for good oral hygiene is rub some coconut oil on your gums. You can oil pull for 20 minutes if you want to. Personally, I don't have the patience for it. I'm just
Right.
done.
Me either.
Yeah. So take it on your finger and finger brush, finger brush, phosphorus brush your teeth at night, of course, and then finger brush that on, leave it on
Mm-hmm.
because coconut oil is fungicidal, bactericidal, and it just works really great. And then I like to follow that with mouth taping. So if you just vertically tape your mouth so you breathe through the nose, that's the best hygiene that I could ever give everyone. If I was going to give
Interesting.
from start to finish, that would be my recommendation. And it's thorough, it's complete, a couple of easy steps, and it will have the biggest impact on you. Not only are we addressing the microbiome with the brushing, flossing, coconut oil, but that mouth taping is getting keeping that environment in the right place so that way it doesn't get dry. And also, we're forcing you to nose breathe, which is activating that nitric oxide for whole body health.
Well, it's been a great conversation. I wanted to end with a practical tip, if you can share. What practical steps can listeners take today to create more toxin-free healing environment in their mouths?
The best thing to do, toxin free, is honestly, I would have to say, no, it sounds really cliche, but obviously you know about flossing and brushing your teeth and
Hmm.
now scraping your tongue. And I would say my next layer that I would recommend would be the mouth tape. I feel like that's going to make the biggest impact on your mouth. The main reason is because it's going to help you prevent cavities and gum disease. I know earlier you asked me about, hey, what are some materials? We definitely have biocompatible materials we can utilize, but I personally like to start with let's avoid the cavity to begin with.
Sure.
So, yes, we have alternatives, but let's start with prevention because that's the mindset that we want to be in.
I agree. The preventive mindset is so important for our overall health. We should be more proactive in doing the things as part of our lifestyle and our diet and the stress we have and everything that involves our well-being, and being more proactive in taking steps to keep us in a better state of health, because it's so much easier to maintain that state of health than it will be to try and reverse something once we start seeing that chronic illness. So I agree with that. Thank you, Dr. Patel, for being on today and taking time out of your busy schedule to talk about this. I hope that it's opened the eyes to a lot of listeners about the need to put a little bit more emphasis or to be more proactive in their oral care and how that might affect their overall well-being. It's probably going to shock a lot of people to hear some of the things that have been shared, how much the oral cavity can affect your overall well-being. So I appreciate all that you've shared and the wisdom and tips that you've given.
Well, thank you, Scott. I appreciate you.
Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.